Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us discuss that what is the exact sequence of events when you meet a test tube baby specialist for the first time and which is the correct time to meet an IVF consultant. Now, we know that patients who cannot conceive naturally are either referred to a test tube baby specialist or they themselves can consult an IVF specialist. If you have consulted your previous doctors previously, whenever you are meeting an IVF specialist, the best time to consult is during your menses, that is second, third or fourth day of your menstrual cycle. When you come to your IVF specialist, you can show your previous reports which have been done, which give us a fair idea of the reproductive profile of the couple as a whole, and we can take forward the treatment from there. If you do not have fresh reports, ideally the report should be as fresh as up to 3 months old. If you don't have fresh reports, your IVF consultant will get the reports of the reproductive profiling done during your periods itself. On the second, third or the fourth day, a very important sonography which is known as antral follicular count scan is done, which is a transvaginal internal sonography which gives you a great idea of the number of eggs which are recruitable and whether you can conceive naturally or require an IVF. There are many patients who have done an HSG X-ray to know whether both the fallopian tubes are open or they are blocked. In case you have not done this X-ray, then on that visit you are given a prescription to do this X-ray from the nearby X-ray center after the 5th day and before your 10th day of the period. In the same cycle, you can get your HSG testing done, which will tell us whether the tubes are open or not, and then you can come for a follow-up again. Is it important for the husband to accompany the wife? A very important thing. We know that both the partners have to be investigated thoroughly for us to be able to know what method of reproductive treatment is required in your assisted reproduction treatment. So husband semen analysis is equally important, which is done in the first visit itself to know the count, motility, morphology and abnormality in your sperm factor. So if you have consulted previous doctors, it's a good idea to get all these reports so that you have to do minimum investigations later. If you have never consulted a doctor, then you can do all these fresh investigation so that in just 2 visits, the IVF consultants are able to tell you the exact method for your assisted reproductive management. Thank you.